Let's talk antifungal medication because there are a lot of fungal infections that are pretty common. We've got these systemic infections, which are kind of bad. They get into your blood and your bones and your lungs, and like this aspergillus, pretty bad. But we have these pretty common kind of skin, hair, nails, mucous membranes type of fungal infections like athlete's foot, like ringworm, like yeast infections. So when we have these fairly common fungal infections, well, we have a number of medications to treat these. And of all of our antifungal drugs, they're going to do at least one of these things. They're going to either inhibit cell wall synthesis and or inhibit fungal wall or fungal DNA, I should say, fungal DNA, or they're going to inhibit protein synthesis. So we're either, we're trying to kill these fungi or keep them from reproducing. These antifungal drugs can act on one or more of these areas, but we're going after this cell membrane, this cell wall. We're going after DNA synthesis, right? So the drug we give kind of targets a specific fungus, and so once we know or think we know what the fungus is, we can give this drug that will target that individual fungus kind of weakness, that weak point. For four kind of broad categories of antifungal drugs, we've got amphotericin B, which is its own drug. We've got azoles, which are kind of a broad category of drugs. We've got echinocandins, a broad category of medications, and then just kind of other antifungal medications that don't quite fit into one of these boxes. First up, let's talk about amphotericin B. This goes after obviously fungi, but impairs the plasma membrane function in these fungal cells. So we're going after membranes. And amphotericin B in all of its little concoctions are administered IV. So you're not going to send your patient home on this medication. Administered IV in the hospital, in the physician's office. This goes to treat systemic infections, especially meningitis. So if your patient has fungal meningitis, this is going to be a first-line drug for fungal meningitis. Echinocandins treat aspergillus, especially oral thrush. So if your patient has oral thrush, and we can see that here in this picture, we can see oral thrush most um, it kind of stands out to us when your patient opens his mouth and you see the tongue. It really stands out on that tongue there. That is all fungal growth. That's a fungal infection right there. So this category of drug inhibits fungal wall synthesis. So again, we're still going after the fungal cell wall, but we are inhibiting the synthesis of that fungal cell wall, so it can't reproduce. And once that that cell wall kind of breaks down a little bit, it's not rebuilding itself, so we can go after and your body can destroy this fungus. Then we come to your azoles, and we call them azoles because they end in azole. So diflucan and lotrimin are very common azoles that are given, and they're given very commonly because they're given for very common fungal infections like yeast infections, like ringworm, like athlete's foot. So if you have just a simple kind of dermal fungal infection, you're probably getting one of these azoles. They'll start you on lotrimin, they'll start you on diflucan. So if you see one of your patients on this, it's for a pretty common fungal infection, pretty simple fungal infection. And then finally, we've kind of got this other category. These other antifungals don't really fit too well in those other boxes. So we've got Lamisil, and you've probably heard of Lamisil. So used commonly to treat nail infections. So little fungal infections under your fingernails, infections, athlete's foot infections again that kind of gets under the the toenails there, and also ringworm, so Lamisil. You can even get that over the counter, so Lamisil very common. And then you might see nystatin. So this is nystatin's typically given in the hospital and for pre-operative prophylaxis. So if they're going in for abdominal surgery, they're going in for especially colon surgery. We're worried about fungal infections post-operatively, so they're going to give nystatin pre-operatively as a prophylactic measure.